Okay, for guests and visitors, my name is Jim Farmer, and I am the president-elect, and I'd like to welcome you to the 31st meeting of the 49th year of the Dublin-Worthington Rotary Club. Today's invocation and pledge will be led by the one and only Win Wixel.
I see. Our Father, today we gather as Rotarians. As Rotarians, we thank you. Thank you for inviting us into your world. Making our world. Help us to be connected. Help us to be fair. And help those who are away from our value set to allow us to be who we are. Thank you for the food. Thank you for all the blessings here today. Amen.
Amen.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, Steve Perley, do we have any visiting Rotarians or guests today?
I don't see any.
Okay,
Just a speaker, I think.
just our speaker, so we can move on. Anyone with announcements, please make your way up front. Do we have any announcements today? Looks like we have one.
There's just one, there's a sheet on your table. The food drive is Saturday, starts at 9 o'clock. Still need a couple volunteers, so sign up on the sheet, I appreciate it.
And also, they need a driver, folks, because we've got to go out of town for funerals, so I can't do it.
Yeah, immediately after this meeting, we were, the Ways and Means Committee, will be meeting here to consider the travel raffle. That's the one item on the agenda. Anyone from the club is welcome to attend that meeting. And we will be evaluating doing a travel raffle instead of our sponsorship drawing this year.
Okay, any other announcements?
Well, I think you all know, Chuck Claiborne's funeral services and wake will be on Saturday. And right this minute, I can't remember, is it Methodist Church in Worthington?
Yes,
Is where the service is and the
10 o'clock.
reception at 10 o'clock, thank you, Rob. And the reception is at Nationwide up at,
Powell Road.
I can't think of the name of that. I spent my honeymoon in that hotel up there, but that was so long ago, I can't remember anything. So it starts at 11 o'clock, goes for a couple hours.
Okay, and now for our sergeant today, Mr. Alan Grossman.
I got applause, right?
Got an applause.
Yeah.
Thank you, Jim. First, I need to have somebody to carry this pot. And there was a great deal of discussion at that back table around whether Jerry has 2 purses, 2 briefcase, 2 book bags. And it was really insistent upon my finding him, but since he's a sergeant, I won't do that. I'll just ask him to carry the pot.
It's actually 2 bags of money.
That's what treasurers do. And here, I'm gonna start that thing off with $1. And I'm gonna do that because I'm guilty of this my own self. There's 2 empty tables in the front of this room. And there's 4 full tables kind of in the back of this room. So if you're in the back, not in the front, please put $1 in there. I think that's, this isn't church.
Yeah.
So there's really not a reason to not sit up in front, right? Let's, so now that that's out of the way, let's go with happy dollars. Who's happy today?
I'm happy.
Rose happy. Rose always sort of happy.
I'm leaving Tuesday for France. I'm taking a group of travelers to Bordeaux, and we're gonna taste lots of hopefully wonderful wine.
Fantastic, thanks. Rose happy to be going away. We're happy Rose going away. Steve?
I'm happy to be back. Spend time, kids had a blast.
Where are your Mickey Mouse ears?
They're in the suitcase.
For the next trip.
Yeah, always be prepared.
Who else is happy today?
I'm happy.
You are happy.
Yeah, I had two things, actually. My husband 2 weeks ago had a mini stroke. And thankfully, everything is fine, or at least as fine as it can be, but I am so thankful that no blockages, no blood clots. We're still going to Mexico next week and I'm thrilled. Second happy dollar is for the magazine that came out on March 1st. So I'm thrilled it finally hit Worthington, and thank you for all of your support and kind wishes, things like that. So thanks.
All right, good to have so many happy people here. Who else is happy? Nick is happy,
Well, I got two.
double happy.
My wife and I are expecting our first kid in August.
Yay. Wow. No stress in your world.
If it sticks by me, I'm a banker. You're gonna need it.
Charlie,
My joy is seeing my adult child on stage and is in the middle of a whole eight performance of producers. I've seen 5 and there are 3 left. If anybody likes a good play.
right,
They're excellent. At the Jewish Community Center.
is there any more happiness in this room? I just can't stand it. Ken Carey.
Heading south tomorrow for a couple rounds of golf and attending the St. Pete Grand Prix race on Sunday afternoon.
Nice. All right, then, last call for happy dollars. If you didn't put a happy dollar in, it means you're miserable, so now we're gonna get a miserable dollar from everybody that's not happy. Reach into your pockets deep, please. If you're not here in this room with us, that means you're on that computer thing, and so I've given special authority to, Jennifer to bill you all $1. And, I'll leave it at 1. Who's not wearing their pin, these cool pins that we give everybody that shows up? If you're not wearing one, please put up your hand and, Jerry will collect from you $1. Jerry already mentioned our food drive. If you're not signed up for it, shame on you, you should be signed up, because we need help. So you can put $1 in, and then, gosh, does anybody know that we have a greeter committee?
Yes.
Uncle Harry needs you. So if you're not on that greeter committee, please raise your hand and Jerry will collect $1 from you. And there's a whole bunch of dates that came out in an email not long ago where he could use some help. Yes, sir, George.
Being generous.
I just want to get $1 collected. I like that. Okay. There are at least 2 people in this room that have birthdays this month. Well, there's 1 anyway. There was 2. So if your birthday is this month, congratulations, happy birthday. If your birthday was last month or next month, raise your hand. 2, 3, 4 hours. All right, so you guys can throw a buck in. Remember, we can only do 3, but we'll have you put a buck in to support the birthdays from this month, because those guys need a gift of some sort. And that, I guess that's all I got for today. Let me ask you a question. What made the whale blush? What made the whale blush?
A red herring.
Oh, no, he saw the ocean's bottom. Thank you, everybody.
Thank you, Alan. And our speaker today will be introduced by Linda Frederico. Lisa, excuse me. Lisa.
I'm really excited to introduce everyone to Jeremy Rosario Maldonado. I saw Jeremy at a community chat at the McConnell Center probably about a month and a half ago, and I was blown away by the work that Jeremy, excuse me, is doing in our community. He has worked for a group called Disappearing Doctors, which he's going to talk a little bit about. He's also a very talented illustrator and artist, and the work that he's doing in our community is just fantastic. And so with that, I will introduce you to Jeremy.
Should. Figure it out on the fly.
Well, hello. Thank you very much for having me speak to you guys. I'm extremely excited about meeting all of you in give you a little bit of a background on what I have been up to in the last year. As I read through your website, Rotary, what it stands for, and I was thinking, this constant rotation of amazing supporters and people bringing innovation and support and to heal struggling communities, right? And affect those within our circle of our own circle. So proactive purpose is something that I think of when I saw your logo of Rotary, what it means. So thank you for everything you do.
Could you grab the mic?
Yeah, can you,
Closer.
okay, can you hear me better now?
Yeah.
Okay, nice.
You can take it out if it's easier.
All right. So, within practice purpose, as it relates to Rotary, I have two definitions to remind us of before we get into the work. Purpose is a reason why we get up every morning. And proactivity really sparks our action, establish directions. It opens possibilities and help us find meaningful solutions. And I believe you guys are the embodiment of that after looking at the website and information from Rotary. I'll give you a little background on me, and I'm currently working as a VP creative director with FCB Health in New York City. I have been in the advertising creative field for 25 years, or maybe a little longer. I'm getting up there now. And it has been just an amazing career of launching products, brands all around the globe. Really excited. And within the last 2 years, I've been with FCB Health in New York City. As I mentioned, working remotely from Delaware. So that has been really cool, but it wasn't always like this. So I'm gonna share with you some stories from my own journey growing up, just to give you a little background. Why am I doing that? A couple of years ago, I learned the importance of, okay, can you hear me better now? Not yet? Okay, a little closer. The importance of embracing our backgrounds and our journey, our beginnings.
Oh, the batteries are dying.
The batteries are dying?
Yeah.
Okay. I'll take it. Take it. So just in the very back is, maybe I can project more. Can you hear me okay like this? Awesome. Let's go old school. We don't need a mic, right? All right. So, again, I'm gonna share with you a little bit of my background. Growing up in Puerto Rico, my mom, I'm a result of a teen pregnancy. And, for many years I struggled with that, but over the years, I get to really embrace and celebrate the uniqueness that a lot of those challenges through life really engrave in my heart, right? Love my mom. We went through some early years of difficulty, but those years really opened my my eyes to possibilities about innovation and really not letting circumstances dictate what purpose in life could be. How we respond to those actions is really important. On the right there is me when I was 5, graduating from kindergarten. And back then I had some thoughts, okay, what I want to do in life, and I think God put in my heart at the time that I really wanted to make a difference in everything I do. And love my family and my sisters and everything. When I was in 5th grade, I used to go home after elementary school, and I used to pass an art shop called Mavo Art Shop in the town where I grew up, where you have some individuals there doing murals, typography, 3D signs for businesses and buildings. And I was always fascinated on this group of gentlemen that use art to make a living. So I approached him one day, and this is Papa Wise, the guy who led that art initiative in that town as a business. And I asked him, can I be your apprentice? I can come in here and learn and see what you guys are doing. And they welcomed me and took me under their wings. So as an elementary school kid, my job was to clean the shop, clean brushes, but it gave me an insight on how they were working, how they were utilizing color theory, composition, image making, and a lot of this really interesting attributes that kind of are the role foundation for art, for a good artist. And on Fridays, they used to give me $5. So I used to run to the bakery, get some bread and milk and bring it home to help contribute. And because I had 2 sisters, and again, those years, things were very limited. But at the same time, they were beautiful years because don't know, we didn't have cell phones and we had friends and circle of, influence around you that really made life, easier to do, right? So within that, within my work, one of the purposes that I like to apply to the work that I'm doing, it's is to be salt and to be light. And what does that really mean? Coming from the Latin culture, salt, sometimes I translate it as flavor. A lot of times it could be things that are boring or they may lack a sense of flavor. So I think we all have the ability to do that. But it also means preservation. We have communities, people, family members around us that may be struggling with different things. And to be salt to them, it really helps preserve their lives and enhance how they live. From our perspective, to be light is something that I learned early on. When you're doing art classes and you're working on still lifes with multiple light sources around an object, light reveals a lot of things, reflections, imperfections, and things. And I thought, what if I were to adopt that attitude that every time I attack a project, if I bring light, it's gonna help the strategist see things that they didn't see before. It's also gonna help me maybe come up with solutions that we may have not thought about. And that's how I approach my daily work. I don't have examples of my daily work here because since we're launching a lot of pharma products, some of this stuff we can't share to the public until after things are on the shelves. But that attitude, it took me to study art at CCAD. I came here in 1992, and originally I wanted to become a painter. Through the mentorship of some teachers, they told me, you're not gonna make any money as a painter, go into advertising and design. So I kind of went down that route, but I have gone through many years of where I really wanted to go back to my passion of painting and using fine art to make a difference. And I think within the last 2 years, I want to share a couple of projects that really hit on that realm. One of the things that I have been really passionate about is helping the uninsured. And about 10 years ago, I became a translator with Grace Clinics of Delaware, which now is Grace Clinics of Ohio. We help save the state of Ohio more than $1 million a year by seeing patients that otherwise cannot be seen at hospitals or urgent cares or clinics. By an amazing staff of physicians, everybody's a volunteer. So sometimes I joke that if we don't have any Spanish speakers, they're gonna fire me. So, but we're all volunteers, so they're not gonna fire me. It is an amazing platform where, I get to leave my work behind and go there at night. And it's a platform where a lot of healthcare providers, pharmacists, nurses, they all go in there because they love people as a medical ministry to really help heal those communities. One night I met Mary Rose and Joni Thompson, and their friendship kind of it opened my eyes. I wanted to learn more about them. So as we got to know each other that year, I learned that Mary Rose, she does everything for Joni. They're good. They were neighbors because they had cats, and that's how they met each other. There was a third friend with cats also, and unfortunately, due to dementia, her friend passed out in the cold. She left the house one night, and so it bonded them really close together. Joni does everything for Mary Rose. She goes to the grocery store late at night. If Joni wants a candy bar, you'll see Mary Rose going to the CVS pharmacy before they close to do that down in Delaware. But here's the key about being salt and light and an influence on those around us. That really, it was just a beautiful thing for me to see. When they leave the clinic, Mary Rose always leads the way with a flashlight. And what if I were to tell you that Mary Rose is in a wheelchair and she had this extremely thick glasses? She has a lot of difficulty seeing. But she wants to make sure that she is salt and light to her friend Joni, to make sure that she gets home okay. And to me, I think that picture, being able to see that, it really it causes me to stop and think about priorities, what I'm doing, and can I continue taking that example into everything else that I'm touching. Yeah, I don't know if I mentioned it already, she straps her flashlight with duct tape on top of the wheelchair, motorized wheelchair. And how cool that sometimes we may focus on our limitations to prevent us from doing something, but yet being salt and light, I think those fears are quenched, and then you can really lead with purpose to help your own family, circle of influence, communities, etc. I'll skip on at work. Outside of our regular work, one of the things that I love about the agency that I work for is we understand that creativity can have a power to help solve some of the hardest things that are being affected, that communities are being affected with. And one of those is I joined a group called Disappearing Doctors, which some of the data reveals is in 2020, more than 400 doctors are dying by suicide. And to me, I was like, whoa, I had no idea. Institutions, they usually brush this under the rug and nobody knows about it. You know, where's Dr. Such and such? Oh, I heard he had cancer, but the truth is different. In that initiative, the group that I'm working with, they came up with a partnership with CERMO, which is like Facebook for practicing doctors, where they get information about medications, treatment, etc. And they created an anonymous community, confidential community, that any physician that needs help support, mental health support, they can access that channel and get the information they need. When I joined the team, they had just released that tool. And as I got involved, I thought we should be able to do more. The more that I research this topic, it's just really, it is a really hard thing to solve, because you're dealing with accreditation, credentialing, insurance. It's again, just a really, really difficult thing to put. But what if we were to at least begin talking about it and create a level of advocacy that can cause institutions to say, hey, we need to do better for our physicians. Oops, just
Thank you all for being here tonight. This installation is a powerful reminder of those we have lost and the work we must do to prevent these tragedies from happening again.
Now more than ever, probably the most important thing that all hospital systems can be doing as the first step towards supporting the well-being of their workforce.
So it is a small victory to be able to create a platform that brought the key leaders to talk about what do we need to do to remove invasive mental health questions out of credentialing. When that was in place, what happened was a physician, if they needed to get mental health, they could lose their license from the medical board, and then you can't ever practice again. So it's a victory in the right direction. There's a lot more work that needs to be done, and we're working on it. I was invited to the American Medical Association has a delegate annual meeting in June. And we're bringing the artwork. We're also working on a couple of other installations to really help magnify this and maybe provide some solutions. The work was really interesting because I I do deal with a level of, what's the word in English? Anxiety every once in a while. Every time there's a problem like that, you think, how am I gonna solve this? I really don't know. But, putting this idea of, okay, if I were to put myself in the shoes of a physician going through burnout and the long hours and this kind of, things that happen, how will I feel? So the idea of I will feel discarded, almost like imagine giving your all, your passion, your time, dedication, your life into a profession, and then feeling like you're being kicked to the curb. So the idea of using discarded medical equipment came to mind to create these portraits. I have never done portraits out of gluing objects. I contacted a couple of recycle artists, and given the fact that it's a pro bono, they told me, sorry, we need like, 20 grand for portrait. And I'm like, I don't have that money. So let me leave this here. What I did is I started contacting doctors and nurses, and anonymously, they were telling me, Jeremy, yes, we lost another doctor in our hospital. Let me help you. So I've started receiving boxes of discarded and expired medical equipment, PPE, medicine bottles, empty stuff, if you will. And I was dividing that in the studio based on values. Values mean, for those of you who know art, what's light, what's mid-tones, what's dark tones, and maybe use that as my color palette. This is work in progress. I had already been working on the project for about 8 months, and I learned of a friend of mine who had passed. He was a physician, Dr. Ryan Fryman, who came up with a ministry doing addiction recovery, helping thousands of Ohio members, people to recover from addiction. And when I learned that he passed, I thought, oh my goodness, I hope it wasn't a suicide. And in fact, it was. And that got me to investigate a little more about just the extreme stress within this profession, and how the long hours after 2020, his practice, they lost several doctors. So he was bringing home working more than 80 hours a week. You don't sleep. And when you get home, you still have to follow up with patients, charting, dealing with insurance company. A lot of times they don't want to cover the cost of things because of pre-authorization. It's another thing that we're fighting for. And again, it's a really complex thing, but his wife, Sarah, she was kind enough to say, okay, I'll let you use his image to create this portrait, and trying to make sure that we don't lose more doctors through the realities of navigating through such a hard field. Sorry, I'm pointing at the wrong thing. There's a close-up of it, and here's a couple of other physicians. Again, Dr. Scott Jolie from Utah, he was an ER director, and in 5 consecutive occasions, he asked the hospital administration, I am really burnt out. I need a sabbatical. Can you guys hire someone else to help me? And in 5 occasions, he was denied. The administration was like, we really need you to continue seeing patients. We can't do it without you. And those are some of the real pressures that I think I'm pointing in that direction. I think the clicker is here. Yeah. Dr. Lorna Breen from New York Presbyterian Hospital. Again, just an amazing physician. All these people were phenomenal, amazing humans, fathers, husbands, mentors. They really took care of their communities. Dr. Anita Lang from Cleveland. She was a gynecologist that outside of her regular work, she was a volunteer trying to help underprivileged Hispanic communities in Cleveland get free OBGYN care, and also lost to suicide. So again, I think we're just starting, but in September we launched the disposables exhibit, and we're hoping to continue doing that. If any of you guys want to follow us on Disappearing Doctors, this is a social media hashtag for updates and things that we're kind of doing. It's great, so you can be part of the story of what's happening. I'm proud to say it was birthed right here in Delaware, Ohio. So, and hopefully we'll have a ripple effect to really heal are healers all across the United States. That was one project. I'd go a little quicker. Anybody falling asleep? You guys need? Okay, good. Within that same principle of being salt and light, I just wanted to also do something for teen girls. And here's why. I was driving with my daughter to work one morning. When she didn't have school, sometimes I will bring her to the office and I will sit her with an iPad to watch Wonder Woman or cartoons or whatever, and we will hang out. But I remember that particular morning that we're driving to work, on the radio, there was a segment about the increased mental health issues within teen girls. The CDC reported in 2021 an increase of 57% of suicide attempts between girls of 13 years old and 17 years old. And that is really scary. What's happening in our communities that we, I'm sorry, 26%, the 57%, there were some other mental health issues like cutting and things that are affecting. The research on this thing took me to Children's Hospital. They have a new facility allocated to, teen and mental health. I wanted to, I cry walking through those halls because you see parents in a state of shock, their kids in these rooms being cared by mental health workers and psychiatrists and psychologists and everything, but it was something that I can't describe it. I'm sorry, but it is a reality happening in our communities here. We thought, meeting with my daughter, what if we take a step and trying to do something to really help families that may be struggling in secret? Because it's such a stigma, right? People don't talk about it. So the idea was, what if we begin to solve the problem by asking caregivers to engage in meaningful conversations with our daughters? And the insight came from when I was little. I shared with you early on that my life may have been difficult during those early years, but so was everybody else. And my grandmother told me she would sit down and talk to us. And those conversations I still remember. She was planting those grains of resilience through conversation. Grandma, she went to work in a coffee plantation when she was little. Her dad was a gambler that was not a good provider. And they had, I think there were 11 in total. Grandma was the oldest one. So she went to work at this coffee plantation to be able to bring home some money and help brothers and sisters. So conversations like that, I feel like the transparency of it is important, but the children will remember that when they're older. And that really helps cultivate resilience. I feel like children are being robbed of those conversations because of the nature of social media and other things that the world's throwing at them. But the idea is, what if we begin doing that by helping them feel comfortable to open up, boost confidence, that can reduce stress and influence positivity, strengthen relationships too. The next thing is, what if we use museums to bring people together, connecting for place of discussion? And I wrote a proposal to the McConnell Art Center. They were kind enough to welcome this exhibit of the ABCs of encouragement for girls, and we were thrilled. I started with a list, ABC list, and discussing this with my daughter. What would be a good, proper, good words to actually for dialogue? And she will correct me, Dad, you don't want to say adorable. That's maybe active, or maybe So it really brought us closer together through the exploration and the discovery of what those words could be. And the art is super simple. This is vector art. I did this in Adobe InDesign using shapes, circles, triangles, squares, and rotating things. My daughter will do a couple of sketches, and we will meet and tackle things daily. Here's two of the illustrations that I love. Brave, do the right thing even when you're scared. Who of you have a story to share that on a time in your life when you were really scared? And what did you do to overcome that fear? I think all of us have a story like that. In the illustration, the girl's climbing a tree to rescue her cat. But I presented the book already to a couple of schools with my daughter. And what we do intentionally is we're also sharing some stories along with each page about amazing women that actually were the embodiment of some of those words. For brave, I talked about a lady in Poland who was a school teacher, that she helped smuggle, I think, more than 500 Jewish kids out of Nazi Germany during those years, putting them in the back of a wagon. And amazing. I mean, when she was interviewed in her 80s, she said, I wasn't being brave, I was just doing the right thing. So stories like that, I feel like kids just need to be hearing those. Another favorite out of the book, quick. Be quick to learn from yesterday and look forward to tomorrow. Go for it. You know, and I love the analogy of hurdles and track and field. I have never done hurdles. I went to art school. I'm not that athletic. But, you know, the idea of taking up running and jumping this thing, and I've seen videos where somebody just trips and they fall flat face flat, right? Or flat face in the ground. That can be intimidating. But, you know, one of the beautiful abilities that these athletes have is you can get up again. You know, there's going to be another hurdle. Therefore, plan and then jump over it. So getting some conversations like that with girls too could be another thing that is just beautiful. We did a lot of social media work, and we intentionally did not release the book into the public domain. We're using it just as a ministry tool to just edify girls. Therefore, we have a safe Instagram and a social page in Facebook with an email address. So if anybody who wants to purchase a book, they send us a note with a name, and we're able to send back a book that is signed with a letter of encouragement to that specific girl. So they're getting something customized and really neat. When we launched the exhibit at the McConnell, I was really thrilled by the public response. We had so many people. I met leaders from different organizations that are working in the mental health space, helping teens. And
Hey, Bob,
recent-
Tim.
oh, hey, Tim.
Good.
Sorry.
I'm really good considering. How
Good.
are you?
Awesome. Where you been, man? I've been waiting for you.
Well, I've just been going through client accounts and have you been following NVIDIA?
Yeah.
Yeah.
There we
dude.
go. Goodbye, Tim.
Oh, can you hear me again?
Yeah.
Hi, Tim.
Hear you, you can't hear him.
Okay. You know, it's interesting to do some of this art initiative just to see, now that I'm looking at these pictures, the circle of friends that I have made. Dr. Kim here, she is one of the doctors who provided me with medical supplies to work on the disposables. She had shared with me they lost a doctor in Ohio Health up in Cleveland Avenue and Polaris there, Africa Road, last year. So just looking at some of these faces, it reminds me, wow, yeah, it's kind of neat to be in a space now where I feel like I'm living my purpose by not in the daytime job, but actually just keep being involved and bringing innovation and trying to solve issues through art. So I just want to encourage you, yeah, just be salt and light within your circle of influence. Gracias. That's thank you. I think I spoke a lot longer than the 20 minutes. Sorry, I talked too much.
That's fine.
Yeah.
We were early, so do we have any questions?
I do have a question.
Yes.
I feel like it undermines the purpose of everything, but I'm just so curious about all these medical devices and tools you get coming from maybe a non-sterile environment. I mean,
Yeah.
is there a concern about that?
That's a great question. The donations that I'm getting, they are expired things that were never used on patients.
Oh.
And this, actually, that initially showed me that there is just so much stuff being thrown away weekly at hospitals. I just received, I'm part of the concept for the American Medical Association meeting. I have a stack of 100 disposable stethoscopes. And I may be the concept is not there yet, but I'm thinking about creating something along the lines of physicians are spending their lives listening to patients, but we're not listening to their demands of dealing with burnout and the struggle, things of that nature. So they were just discarded. Yeah.
Have studies been done comparing physician suicide rates to those in other professions?
Yes, they have, and they are a lot higher And even within breaking that down, women are even higher than male physicians. ER doctors are leading the way on that thing. And, you know, I did receive some, this project, I'll get closer to here. It reveals some things that I was not aware of, things that we don't think about. For example, I interviewed an ER physician who, he was suicidal. And he had to get in a plane to be treated in a different state because of the stigma. This physician was, in charge of a residency program in a lot of hospitals in Ohio. He's like, I can't get help locally because they're gonna see me. That's stigma, but he opened up about some of the things that ER doctors face, especially working on trauma 1. He told me, let me give you an example. Monday morning, an ambulance brings in a 3-month-old baby girl with a stepfather rape. And we could not save the baby because of the injury. And you just don't have the time to unpack that. You gotta strip, go to the next room where there's a heavy lady with a swollen ankle yelling at you, why did it take you too long to get to me? So the level of pressures throughout the day, with the amount of patients they have to see, follow up, things that are rotating, that could change, they don't have the history within, it's really, it's just super, super hard. I can't describe it any other way. But yeah, to your question, yeah, it's higher than other professions.
And it's accelerated because of COVID?
I believe so. I think after 2020, it was accelerated due to shortage of staff and the increase of patients. Dr. Lorna Breen, for example, her brother created a foundation. He talks about her experience during COVID in a New York Presbyterian Hospital. And just when you have patients that are dying by the hour, the amount of patients, just does something to you. So responsible and really, I wonder that we should be doing some studies on burnout because it definitely is doing something in the minds of these physicians. And again, I consider them the bravest and the smartest. These are people that go through a very rigorous training and rotations that used to include 130-hour rotations. One thing that I wonder if we can be advocating and fighting for too is the OSHA, when it comes to pilots, they limit the amount of hours that you can be flying. But if you're a physician working 80 hours in 1 week, that's 79 hours. If you prescribe the wrong dose, I mean, and think about it, if you're up for 80 hours, that can be a huge mistake, you know. I'll leave it to that, because I think there's, yeah.
Thank you again, and thank you for all you do.
Oh, thank you. Thank you for having me here. I brought some books from the ABCs of Encouragement. If anybody's interested in them, I have them for $20, but if not, you can send us an email to abcsofencouragement@gmail.com. And when I ship them, they're $28, but we will write a letter of encouragement for any young girls that you may know, granddaughter, daughter, niece, neighbor. Thank you.
Okay, thank you.
Oh.
And now we have a raffle. I believe today our raffle is going to be conducted by, let me see here, Nick Hefner. Are you aware of your raffle responsibilities?
The daily raffle is $18. Sure. Might draw my own one, it's fine. But I can look at it. Winning ticket is 352-26201. It's not mine.
Is it yours?
Usually.
Like this time.
Yes, first.
One last.
Anyone?
What's your win last week?
Three 262-201.
Same thing. Same one?
Same one?
Yeah.
He's repeating.
Yeah, I was repeating it.
I think we have to draw again.
Okay.
That was from last week.
Nobody.
It was empty when I started.
Oh,
you just thought about it.
All right, next one, 352-26165.
Yes.
Don't pay that Disney cruise off.
All right, and the ace of spades is up to 138.
Just the last four numbers.
Just the last one.
No, I like the way you've been doing it.
Such suspense.
That's right. All right, last four digits are 6209.
Bingo.
There it is.
Oh, look at that.
First time ever.
There you go.
Don't do it.
King of spades.
Whoa.
We like that.
Okay, let's stand for the four-way test.
Staying for the floor, but you guys all the time.
On behalf of all the things we think, say and do, first,
Is it a
second,
Is it there? Oh, sir.
third,
Will it be well?
and fourth.
Will it be beneficial to all?
We are adjourned. Now, please don't forget the Ways and Means Committee if you were planning on attending. It's gonna be right now.
Well, George?
Yeah.